United Nations is alarmed by the increase in HIV/AIDS infection rates in Egypt. There's been a 40% spike in infections over the past year. While the number of HIV-positive Egyptians is relatively small compared to the overall population, healthcare experts have warned that the situation is an indication of future challenges. Here's Adel El Mahrouky with more.
Egypt is the fourth country in terms of HIV/AIDS infection in the Middle East. The country is home to 95 million citizens. International organizations have estimated 11,000 infected patients in the country. Recent statistics have shown that lately the number of newly discovered infections annually has been increasing by 25 to 40%.
This increase in rates could be a success and not a failure. It means that we are providing services to new areas and segments of society. There are factors for that increase. Either it's a real increase in infection rates or because awareness is increasing, so more people feel comfortable to test and report their disease. It's always good to discover new infected patients. It means that we have the tools to find them and work on supporting them.
Earlier this year, and due to lack in funding from international organizations, numerous NGOs that work in the HIV field have been forced to shut down. Scores of patients are now left without support. Drugs abuse by injection and premarital sex remain the two main reasons for new HIV infections in Egypt. In this part of the world, such infections involve many stereotypes, like premarital sex and homosexuality. So the lack of support from NGOs patients develop trust for could lead to a catastrophe.
We are an Oriental society, so it's always not easy for people to discuss HIV. Awareness concerning the virus is a burden. We don't have the culture to make talks about it simple without judgments from people. This lack of funding will have a great impact. It may increase infection rates even more.
Without NGOs, there will be also a lack of information. Figures of infections will become inaccurate. Already, Egypt has been struggling to make patients come out of the shadows and report their disease. Unfortunately, due to decades of dependency on NGOs, the government alone doesn't have the capacity to fill in that gap. Adel El Mahrouky, CGTN, Cairo.